A long-term care home in Chatham-Kent is in outbreak. At Fairfield Park, dozens of people are sick with COVID-19, both staff and residents, with a number of agencies rushing in to help. Some of Windsor's most vulnerable have had limited contact with their families throughout this pandemic. It's a balancing act for staff at Community Living Windsor between doing what's best for the people they support while also keeping them safe. A live look at our city there. Doesn't look like it now, but there is a weather advisory in effect from Windsor all the way to Sarnia. 5 to 10 centimeters of snow are possible tonight, and that's supposed to start around 7 o'clock. Colette Kennedy will give us the full breakdown later in the program. Good evening, I'm Katerina Georgieva. Chris is away. A decision today in the 2017 Ganacho Trail attack. The man convicted of second-degree murder in the death of Sarah Ann Whitholm has been sentenced. This case is something the public and the mayor have been watching closely. The CBC's Tamina Aziz joins us live in studio. Tamina, what did the judge decide?
Habibullah Ahmadi was sentenced to imprisonment for life with no eligibility of parole until he has served at least 13 years. It didn't take long for Justice Bruce Thomas to deliver his decision, and because of lockdown measures, the trial took place over Zoom. Ahmadi, his lawyer, the Crown Attorney, and Justice Thomas were all present virtually. The entire process lasted just over 20 minutes. Thomas weighed both aggravating and mitigating factors. He called the incident a brutal attack, recounting the event, saying Habibullah Ahmadi made multiple strikes to Sarah Ann Whitholm's head, damaging her brain beyond repair, that he tried to escape and hide any evidence of the crime. We know that Ahmadi told police he was scared of Whitholm and he blacked out when the attack happened, and that he was high on marijuana and magic mushrooms. Justice Thomas says Ahmadi was still in the right state of mind to be aware of his surroundings and understand what he was doing when he severely beat Whitholm. Ahmadi was 21 at the time. Whitholm was 75. Whitholm was transported to a hospital with life-threatening injuries after the attack. She died a year later in 2018. Ahmadi was originally charged with aggravated assault. A charge of second-degree murder was added after her death, and he was found guilty of second-degree murder a few months ago. In today's trial, Thomas also took in the fact that Ahmadi is a young man. He's now 24 years old. Justice Thomas says he has no previous records. He has a supportive family, friends in the community, has taken courses to better himself, has good prospects of rehabilitation, and expressed remorse for his actions. He considered all victim impact statements and the community impact statement from Mayor Drew Dilkins that he released just a few weeks ago. Justice Thomas says the mayor's statement only emphasizes what he already knew, that a crime like this in a popular recreational area brings anxiety to the community at large, and with no apparent motive, it only increases the impact.
And Tamina, what did the lawyers have to say after the sentencing?
The defense and Crown Attorney didn't provide any further comment at the end. In an email statement to CBC News, the Crown Attorney said, Justice Thomas heard all the facts and applied the law to determine a fit parole ineligibility period in the circumstances of this horrible case. I respect his decision. CBC News reached out to Patricia Brown, the lawyer representing Ahmadi. She had no comment. Finally, Justice Thomas said that this was a difficult trial. He says he hasn't lost sight in the loss of Whitholm's family and friends. He called her a loving mother, grandmother, friend, and supporter of her church. Justice Thomas says he hopes the best for Ahmadi during custody. Kat.
Thanks, Tamina. The CBC's Tamina Aziz reporting live. Chatham-Kent is experiencing its first major long-term care home outbreak. Fairfield Park in Wallaceburg has 87 active cases of COVID as of this morning. Local agencies are rushing in to help as the case counts mount. Our Jacob Barker has that story.
Lean into bravery and make room for hope. We can do this. That's the message that those inside Fairfield long-term care home want to send while they deal with this crisis. Chatham-Kent has kept COVID-19 out of long-term care facilities for the most part up until now. In fact, the region had no cases among residents until January. Now with the case count rising at Fairfield Park, Other agencies are being called in to help out.
We are undergoing cycles of retesting people and cohorting and isolating both the affected and their contacts, and this is an ongoing situation.
Numbers posted by the home on Tuesday said that there were 32 residents, 26 staff, and 1 essential caregiver testing positive for the virus. Dr. Colby, speaking this morning, said that number has now grown to 87, but was unable to say how that number breaks down. The home has 103 beds. He says that right now it's critical to keep the facility staffed.
When you get large numbers of staff being isolated because of contacts, then you end up with staffing issues. So I would just like to differentiate between the idea of getting outside help to manage the outbreak versus getting outside help to staff the facility. And that's the critical situation right now, is getting outside help to staff the facility.
Chatham-Kent Health Alliance has redeployed a number of staff here to provide hands-on patient care, and a number of other agencies are also providing support to the home. The hospital's CEO says that the ministry is fully aware of what services are being sent to the home, and everything is being done under the direction of Ontario Health. Now, the home did not respond to our call today, but in its update online, it did address a number of actions it is taking inside the home to limit the spread of COVID-19, which included isolating residents to their rooms, routine monitoring of health measures, as well as immediately testing residents who develop symptoms. It also addressed the question of why residents in the home were not vaccinated. Here in Chatham-Kent, they got COVID-19 vaccines for the first time on January 25th. The home says that at that time, Fairfield Park was beginning to observe evidence of significant transmission within the home. So in alignment with Ministry of Health guidance, the difficult decision was made to temporarily postpone resident vaccinations at Fairfield Park. If residents had been vaccinated as planned, illnesses would not have been prevented, as so many had already been exposed. It takes a number of weeks for vaccinated individuals to be well protected. Now, the home does say that it remains a priority for vaccine rollouts, and it will share any information with care teams and others when that becomes available. It also says that if a resident tests positive, they will let their primary contact know directly by phone. Jacob Barker, CBC News, Wallaceburg.
A well-known parish priest is recovering from COVID-19. Father Maurice Restivo is in isolation in a home owned by Assumption University.
He's doing okay. He's recovering at this time, but I don't believe it was a severe case.
Father Maurice went into isolation at the home in a retreat on January 17th. He was diagnosed with COVID last Saturday. On Tuesday, he went to the emergency department but was not admitted. He's also being treated for pneumonia. The priest has received an outpouring of well wishes from parishioners. The diocese can't speculate on when Restivo is expected to recover. New cases of COVID in Windsor, Essex remain in the double digits. 20 new cases today, and 2 more people have died. All the while, there's still no sign of the next shipment of the Moderna vaccine. The health unit is expecting it sometime this week, as it's in the middle of giving second doses to long-term care residents right now. Officials hope the shipment arrives before they run out of supply.
We are cutting it close. We need this shipment to reach our health unit destination and move forward. So right now we're doing the second doses, but we'll be in much better. I'll feel a bit better when we get that shipment.
And Windsor Regional Hospital is partnering with the University of Windsor. It'll be using the Windsor Hall building as a backup vaccination site. That's if the St. Clair College location, which is where the Pfizer shots have been administered, has to be used as a field hospital again. Eventually, when mass vaccination begins for the general public, the downtown location will be one of multiple vaccination centers in the region. There's good news and there's bad news about COVID-19 vaccines coming to Canada. While one supplier is getting back on track, the other says it won't be able to meet its immediate commitments. And the Liberal government is coming under fire for a plan that could scale back some doses going to poorer countries. CBC's David Cochran has the details.
After weeks of drastically reduced deliveries of the Pfizer vaccine, finally some good news.
They're forecasting shipments of at least 335,000 doses the week of February 15 and 395,000 the last week of February.
But that good news quickly offset by more bad. Moderna will likely reduce its next delivery from the scheduled 250,000 doses as it struggles to meet global demand.
So at this time, I can't really tell you what the quantity will be, but we do not expect to receive 249,000 at this time.
So the vaccine roller coaster continues, with the government under pressure for not having enough.
We are failing right now. So Mr. Trudeau, show us the plan for these doses you've promised.
While also being criticized for taking too much.
Learning that Canada is the only country in the G7 that is going to access COVAX.
COVAX is a global effort to encourage wealthy countries to buy vaccines for poorer ones. The incentive is the wealthy country gets a vaccine dose for every dose it donates.
COVAX has always been part of Canada's procurement strategy.
Canada is one of COVAX's biggest contributors at more than $400 million, but it's opted to take its doses as soon as possible while other wealthy countries wait.
Our government will never apologize for doing everything in our power to get Canadians vaccinated as quickly as possible.
The criticism is that Canada should leave those doses for low-income countries. The urgency is that Canada's vaccine supply has been inconsistent. In the weeks that Pfizer and Moderna shipments have been reduced, Canada has dropped on the global vaccination charts from number 10 down to number 33. David Cochran, CBC News, Ottawa.
Calls for federal control of quarantines for migrant workers arriving in Ontario have gone unanswered. Migrant worker advocates, the greenhouse industry, and even the local health unit would rather not see supervision left up to employers.
That idea was floated. We were some of the early proponents of it, if not maybe the proponent of it in the original. It makes a lot of sense. The question is whether you've got facilities, large enough to do that.
We think that the federal government and the provincial government should jointly be held responsible for the quarantine period, and the costs should be uploaded where both governments are paying for the quarantine period of time.
But he adds there's plenty they'd like to take into account, like culturally appropriate food and ability to have recreation during quarantine. Right now, arrangements are left up to the farms and greenhouses. Farms get $1,500 per worker to help deal with the costs, but many have suggested that Ontario follow BC's lead. There, the provincial government's program pays for a hotel and food when workers arrive. When asked about this by the CBC, the federal government did not address the idea of a government-run program, but did say it would continue to look at all options to protect the health and safety of temporary foreign workers, employers, and communities. Windsor's Matt Gallagher set out to make a documentary about the city's field hospital at the height of the first wave. It turned into his most personal project yet when his own father got COVID-19 and required treatment there.
You're a great guy too, Dad. I love you. Thanks. We're gonna get you out of there soon.
Gallagher included letters and phone calls between his mom and dad in dispatches from a field hospital. He also had a chance to go inside, but only after all the patients had been discharged or had died.
There was a month or two where I was allowed to actually go into the field hospital with all the caregivers. I spoke to 8 or 10 caregivers who took care of my dad and took care of all these other patients and ran the field hospital. And these were caregivers who were masked and in PPE and all that stuff. But for the purpose of this interview, I actually got to see their face for the first time. And so we sat in the place where they took care of these patients for 2 months, and they told me what it was like on the inside. And so we walked through the 57 days that that field hospital was open for. It was powerful.
Gallagher's film will premiere on TV Ontario next month. Some of Windsor's most vulnerable people have had limited contact with their families throughout this pandemic. It's a balancing act for staff at Community Living Windsor between doing what's best for the people they support while also keeping them safe.
Well, I miss my family.
63-year-old Mark Forster is one of the many individuals supported by Community Living Windsor. The agency helps those with intellectual disabilities. When asked how long it's been since Forster last hugged a family member,
Oh, long time ago.
how hard is that? How does it feel to not see your family?
Hard.
Yeah.
Sad.
The separation has also been tough on his dad.
It's quite challenging. Of course, you miss that personal contact. Before the COVID, I would go over and take Mark out for coffee, play cards, or occasionally take him to the casino and play the penny slots. We always had a competition going on there.
All that no longer possible. The agency is not allowing family visits inside its 42 homes. It's a tough choice, but it's about keeping everyone safe.
Our goal is to get everyone to the other end of this, frankly, alive.
The isolation has been tough, but Mark's housemates and support staff offer companionship. During warmer months, outdoor visits were sometimes possible for Mark and his dad with PPE and physical distancing. But not everyone was able to do that because some struggle with masks, not understanding why they can't touch. In those cases, window visits were arranged, but for some, even that was impossible.
And we've actually had families communicate this to us where they feel like if they visit the person, it's going to actually upset them more because they're not going to understand why they can't go in and why they can't sit right next to mom and dad and touch them and those sorts of things.
In the meantime, phone calls and video chats fill the void, but it's not the same.
It's the family connection part that is really difficult.
This manager says the loss of the physical connection is taking a toll. Some, like Mark, understand why they need to be apart from family. Others struggle to make sense of it all.
All the people that we support that they don't speak. They don't have to speak for us to know what they're saying because we know them really well. You can tell by their body language that those are nonverbal cues, right? Well, we have seen some people escalate it more than usual, because they're trying to communicate that, why am I not seeing my family?
Visiting exceptions are made in the rarest of circumstances, like if an individual is experiencing serious emotional challenges. The homes haven't gone untouched by COVID, 9 outbreaks so far. Aside from one active outbreak, everyone has recovered, but it's a reminder vigilance is vital. Before COVID, Mark was often out in the community. Now, this is his virtual activity schedule. For an outgoing guy, it helps keep him busy.
Karaoke, bingo.
His dad is grateful for that, something to pass the time until things get back to normal and he can see family once again. What are the first things you're going to do?
Hopefully get to see my family.
Maybe give him a big old squeeze, a big hug?
Yeah. That's what I miss about having him.
You can read more about Mark's story on our website. You can just go to cbc.ca/Windsor. A live look at our city there. We are expecting snow tonight. It's supposed to start at around 7 o'clock. We could get up to 10 centimeters. Colette Kennedy will join us right after the break to tell us all about the weather advisory, what we can expect. Stay with us. Colette Kennedy joins us now for our full weather forecast. Colette, we've got a weather statement in effect for the region. Snow is expected. What should people know?
Yeah, I'll walk you through all of that, Kat, because we do have this system that's going to be, the most crucial thing is going to be the first few hours of this in terms of our snowfall accumulations, because it's going to be heaviest near the beginning, and then it turns into more of a mix. Why? Well, look at these temperatures very close to the freezing mark. It's at the freezing mark for Windsor, 1 degree for Chatham-Kent, but we're pulling in some cold air with this system to start. So that's why the accums have gone up. The accumulations have gone up a little bit higher. The other thing that stands are the winds that are going to be really picking up through overnight hours. We're looking at a south to southeasterly flow, but check this out. By the time we get into tomorrow morning and even into tomorrow afternoon, but especially through the morning hours, some of those gusts will exceed 60 kilometers an hour, getting close to 70 and coming more from the southwest. So a very blustery day to go along with this. Most of the precipitation, though, coming in this evening. It's right knocking on a doorstep now. Starting to see some flurries. Are you out your window? Yeah, because it's just beginning. And then it comes through over the next, like I said, 2 to 3 hours as it sort of intensifies as we get towards midnight, and then it turns into much more of a mix, and that will have an impact on those numbers too. Other parts of the province here, it's not going to turn into a mix. It stays as kind of light, wet snow. So general amounts 5 to 10 centimeters. That's why the winter weather travel advisory for poor driving conditions. Timing this out, by tomorrow morning, it's gone, but the winds and some flurries remain in place. And in terms of the accumulations amounts, 5 to 10 centimeters, I do think Windsor will be closer to the 5, but just a little bit further east, it's going to be more enhanced. And so, you know, we could get there. So something to be aware of. -3 tonight will be your low. And that cold air that comes in, by the way, behind Kat, is going to keep what snow falls on the ground and keep it around.
All right, so got to stay bundled. Thank you so much, Colette.
You're welcome.
Now, when we come back, we'll tell you about a symbolic repayment in Nova Scotia to the family of a Canadian civil rights icon. Stay with us. The Beijing 2022 Winter Olympics exactly 1 year away, the host country has been mired in controversy. A coalition of 180 rights groups, including several based in Canada, are calling for a boycott over human rights issues in China. But the CEO of the Canadian Olympic Committee disagrees. He says Canada must take part.
The pressure's certainly not coming from Canadian athletes or from people within the Canadian sports system or within the international sports system who are of the consensus view that these games are important, that it's important to be there, to compete, and to inspire the world and to inspire Canadians.
He also says that boycotts simply don't work and that diplomacy should be left in the hands of diplomats. A final decision on whether Canadian athletes take part in the Olympics rests with the federal government. Nova Scotia made a symbolic repayment to the family of Canadian civil rights icon Viola Desmond. The check for $26, the amount Desmond had to pay for her 1946 protest against racial segregation. Desmond was arrested and dragged out of a movie theater in New Glasgow when she refused to move from the whites-only section. Her sister spoke to CBC News about the province making amends.
After all this time, and to return, to give her back the money, the fine and the costs of the court costs, that's $26. It's unbelievable almost. But I'm happy about it.
The commemorative check will be displayed in the Nova Scotia legislature next to Desmond's pardon. The province issued that in 2010 to acknowledge the injustice done to her. That is it for CBC Windsor News. Thanks for watching. For the latest on the outbreak at Fairfield Long-Term Care Home, you can go to our website for that, cbc.ca/Windsor. And we're on social media as well. You can find us on Facebook, Instagram, and Twitter. The Rick Mercer Report is up next. Have a great night.